Hi everyone, and thank you for joining today's webinar, the November Model Aquatic Health Code Network webinar. My name is Kelsey Edge. I'm a program analyst with the National Association of County and City Health Officials, and I'll be serving as the facilitator for today's webinar. Before we begin, I just have one quick announcement. All webinar participants, excluding those speakers today, are muted to avoid any audio feedback. So please use the chat box on the right side of your screen to submit any questions or comments following today's presentation. We'll have about 10 minutes reserved for Q&A today. But as always, feel free to engage with each other in the chat box during the presentation and talk to each other. All right, I will now hand it over to Doug Sackett, the Executive Director of CMAQ, for some quick updates.
Thanks, Kelsey. Next slide. I had three CMAQ updates that I wanted to talk to you about. One is that, as most of you have probably seen, at least those that are CMAQ members, that the Technical Review Committee and Technical Committee applications are due by this Friday, November 11th. And this is with regards to the upcoming, the 2017 Vote on the Code conference and the opening of change requests. So any folks that are interested in being considered for either Technical Review Committee or Technical Committee, please submit an application. You can contact me later if you're not familiar and you do want to participate. Second item is, you may also have seen the email that went out that our change request form for the 2017 MAC update cycle is now available on the CMAQ website. One notable update on that is it's an electronic submission form only. Hard copy forms are no longer accepted. And you can also access that on the CMAQ website. And lastly, we've had a series of CMAQ listening posts, and the one at the World Aquatic Health Conference in October was we were very pleased with the outcome of that. And the idea and intent of the listening post is to start to craft and discuss potential change requests for the upcoming 2017 session so that we can have some preliminary discussions and organizational meetings around those to have better formulated change requests. So the outcome of that World Aquatic Health Conference listening post was there's numerous potential change requests identified, and what we've done is have a CR champion, or somebody that's agreed to take the lead on that, and also members that want to be involved in that. And those lists of the topics, the champions, and the members, we're going to be distributing that in the very near future, and it'll be posted on the CMAQ website. So if you have some interest and see a topic that you want to participate in, you want to become a member, you can you'll see it on the website and can go from there. Okay, Kelsey, thanks. That's for the update.
Thank you. And if you have any further questions for Doug, feel free to email or call him at his contact information on the screen. All right. So now we will begin our featured presentation. I'll hand it over to Matt and Svetlana. And let's see. All right, here we go. It'll take just a moment to load.
Thank you, Kelsey. Can everybody see our screen?
Looks good on my end.
Okay, very good. Well, good morning, everybody. We appreciate your invitation to present on this series of incidents that happened in California last year on chlorine exposures at recreational swimming pools and the lessons that we learned at the state level and at the county level. Pardon me pressing the wrong button. There we go. So this presentation will cover the structure of our agencies to explain who we are and why we participated as a group in this investigation, and how County Environmental Health Hazardous Materials and the State Health Department integrate to address environmental hazards such as chlorine releases. And I'm going to turn the presentation over to our county colleagues, to Matt and Michelle, who will discuss county's investigation and response, and then we will wrap up and discuss the state perspective and other incidents that also occurred in 2015 and really bring it home to the Model Aquatic Health Code. So this particular project began in June of last year when Contra Costa EMS responded to reports of a mass casualty incident at a city-owned recreational swimming pool. It involved mostly kids with symptoms that were consistent with a chemical irritant. And as you can see from this slide, a lot of children experienced vomiting, coughing, and eye irritation. Many of them were transported by EMS for observation at a hospital, and one was actually admitted. To recap, chlorine is not good for anybody. It is widely used and commonly manufactured. It is a respiratory irritant, and the severity of the symptoms really depend on the concentration and duration of exposure. You may have tissue injury and resulting pulmonary edema at chlorine concentrations of about 40 to 60 parts per million, and really high concentration of 430 parts per million can be fatal. Harmful exposures to chlorine can occur due to industrial incidents. For example, when a pressurized chlorine gas is released from a storage tank. An example of such incident happened in Graniteville, South Carolina in 2005 when 9 people died from chlorine gas exposure when a train derailed and a ruptured storage tank released pressurized chlorine. However, chlorine gas can also be generated by chemical reactions, for example, by a combination of a strong acid and bleach, which would liberate chlorine gas. And you may want to keep this in mind because you will see an example of this later in the presentation. So going back to who we are and what are we doing here, what common interests do state environmental and occupational health, county environmental health, and hazardous materials have together in terms of looking at these particular incidents. Our department, California Department of Public Health, has several centers. I am seated within the Division of Environmental and Occupational Disease Control, as my colleague Jason here is as well, who will be presenting at the end of this talk. Our center is called Chronic Disease Prevention and Health Promotion. We also have a Center for Environmental Health, which houses our drinking water laboratory and food and drug and radiation management. Within our division, we have Occupational Health Branch, Environmental Health Investigations Branch, laboratory capacity, and also childhood-lead poisoning prevention. And our team that gets involved in these cases is called the Emergency Preparedness Team, that is comprised of staff from occupational, environmental, and laboratory groups. For your information, these are our team's assets and capacities. We work with our local, state, and federal partners and other groups to identify and reduce risks from chemical and hazardous incidents. For the most part, we conduct surveillance of hazardous material releases, do exposure investigations, and we also provide technical assistance to our partners. And we are the working group within our department that bridges ESF 8, which is public health, and ESF 10, which is hazardous materials, for the purposes of emergency response. At the county level, our colleagues are housed within Contra Costa Health Services, and it is the largest segment of the county government in Contra Costa. There are 2 departments within health services. Contra Costa Hazardous Materials monitors and inspects local businesses that use hazardous chemicals. They respond to emergencies and chemical spills, investigating the release and overseeing the cleanup, and they also implement safety programs aimed at preventing chemical incidents in Contra Costa. The Environmental Health Group regulates and inspects food establishments, recreational swimming pools, solid waste, they clean up sewage spills, and oversee body art. So how does all of this fit together? It provides the framework because local jurisdictions would conduct inspections, enforcement, and response. Sometimes these tasks are conducted by one and the same agency. Sometimes they're housed in different agencies, and every local jurisdiction in California is different. And of course, all of you on this call, your states and jurisdictions may be different as well. In our state health department, our emergency preparedness team is uniquely positioned to evaluate and respond to environmental threats and their health impacts in the community, and to look at vulnerable populations and vulnerable facilities, and to conduct surveillance of such hazardous spills, track exposures, and then interface with multiple agencies and multiple local jurisdictions, all with the purpose of holistic approach, looking at root causes of these incidents, looking at the burden on human health with the eye towards prevention. This is how it all fits together, and I'm going to pass to my county colleagues to talk about the actual incident that precipitated this project.
Okay, thank you, Svetlana. My name is Matt Kaufman. I am an assistant director with Contra Costa County Health Services in the Hazardous Materials Division. Also presenting with me is...
Good morning. My name is Michelle DiMaggio. I'm a supervisor with Contra Costa Environmental Health.
So we're going to talk to you guys specifically about an incident that occurred last year at one of our facilities in our jurisdiction. And after looking at the incident, I think it's important for us to start with the initial 911 call. So what I'm going to do is I'm going to play the 911 call that came in regarding this incident. And what you're going to listen to is a fire dispatcher who has many years of experience, I think 10 plus years, taking this call, and she processes it primarily as a medical call because the chief complaint during this call was symptoms respiratory-like and vomiting. And she's going to do a process that's called emergency medical dispatching. And essentially it's a process that's set up to primarily accomplish three goals. The first is to collect information for the first responders that are responding to that call. The second is to prioritize medical calls. For example, a broken ankle has less of a priority than someone that's having a heart attack. And then the third is to provide or instruct the 911 caller with pre-hospital authorized care. So for example, if someone's experiencing chest pain, they may authorize the patient to take aspirin, some sort of intervention that takes place immediately during the 911 call. So we're going to listen to the phone call. What you're going to initially hear is a transfer that's from the local police department to the fire department, and then we'll listen to the call and we'll recap afterwards.
Fire department, location emergency.
We have a whole bunch of kids getting sick from drinking pool water at Antioch Water Park.
What's the address?
4701 Lone Way.
All right. Is it the Pruitt Family Park?
Yes, it is.
Okay, how many kids?
I want to say about 10 to 12.
And they're all vomiting?
A few of them are, a few of them aren't. Some of them are just coughing.
Okay. Is everybody conscious?
Yes, they are.
And so some are just coughing?
Some are coughing, and then some are throwing up a little bit. So we're just all we can provide for them right now is water to try and contain what we believe is chlorine overflow.
Okay. How old are the children?
Ranging from 5 up to about 13.
Okay. And you're with them all right now?
Yes, I am.
Okay. And are all the children completely alert?
Yes, they are.
All right, they're all breathing normally?
Yes.
All right. And any of them complaining of pain?
Not that we know of yet.
Okay. Any bleeding, vomiting any blood?
No, not that we saw.
Okay. We're going to send an ambulance over there. Are there parents there to accompany all the children?
We have a few groups that came in for camp, and most of them are accompanied by a chaperone or with parents.
Okay, so they all have either a chaperone or a parent with them?
Yes.
Okay. We got paramedics on the way. If anything changes, they get worse, calls right back on 911, okay?
All right, thank you.
Thank you. Bye.
Okay, so reviewing the call, as you can see, and as I explained earlier on, she primarily processes this call as a medical call, and she fails, not on her part, but mainly because of the system that we have set up to take emergency medical calls, to recognize the fact that this is a hazmat incident. And what we're finding with hazmat incidents in general, in our jurisdiction, and I believe nationwide actually, is that the number of hazmat calls are going down over time. Our prevention activities, inspections, things of that nature have significantly reduced the amount of hazmat incidents taking place in the community. But what we are finding is that when hazmat incidents do occur, the complexity of those incidents is much higher, and usually involves several failures to result in the release of the hazardous material. So as I said, she processes this call as a 911 medical call, and as a result, based on the symptoms that the children were experiencing, only one ambulance was dispatched to this call initially, 2 minutes after the call. And they were dispatched what we refer to as Code 2, which generally means no lights and sirens, just go straight to the call and abide by all traffic laws. So essentially, this one ambulance was going to the call. They got on scene about 5 minutes later, and they upgraded the ambulance, another ambulance, to Code 3, which is lights and sirens, and then they asked for one engine unit from the fire department to respond for additional manpower. A little bit later on, they requested 2 additional engines because of the number of patients, Code 3. And then the engine gets on scene and requests a hazmat response approximately 15 minutes later. So we were en route, and we got canceled 2 minutes later by the same engine crew that requested us. And primarily the reason they canceled us, in talking to them afterwards in the after-action review, is that there was no active leak currently going on, meaning that they didn't have any evidence that there was green clouds migrating around the site. They didn't have people still experiencing odors. So they believed that the leak had been stopped or had ceased, and so they canceled our response. As you can see a little bit later on, we got re-requested by that same engine unit because they had some concerns and patients weren't improving as they were expected. And so approximately an hour and 45 minutes later from the 911 call, our first hazmat unit arrived on scene. During the process of responding out there, we requested our environmental health counterpart, Michelle, and her team, who you'll hear from in a little bit, to respond to as well, because they share regulatory authority over this incident. As we'll look back later on when we talk about lessons learned, one of the things that we'll talk about is why the hazmat team was activated so late, canceled, and then re-dispatched to the call. So one of the things most hazmat incidents get of any size is media attention. And I bring this to everybody's attention because it is something that if one of these incidents happens in your jurisdiction, it's going to get media coverage, primarily because of the number of patients that were affected, and that most swimming pools are viewed as safe, right? We generally know that parents send their kids to daycare, or camps of that sort, and they go to the swimming pool. The swimming pool is generally fenced in, there's lifeguards, everything's safe. So that was challenged here, obviously, because there was a hazmat incident at this facility. So I'm going to play for you the media coverage that this incident got.
Paramedics rushed to a water park in Antioch this afternoon to treat more than 30 children in distress. The Antioch Water Park is on Lone Freeway, just across the street, Deer Valley High School. News Ken Pritchett is there now, and Ken, it sounds like pool chemicals may be the problem here, right?
Well, Frank, there were 34 children who complained of symptoms that you would expect to see with exposure to a chemical such as chlorine, but many questions remain about just how this happened. There were several pools at the Antioch Water Park, but only one where children complained of being sick, this shallow pool in the far back corner of the park.
Many of the children complained to us of minor respiratory distress, soreness of throat, coughing.
These are images taken just after firefighters arrived, along with 18 ambulances. 17 of 34 children who said they felt sick were taken to the hospital. The Contra Costa County hazmat team inspected the pool chemical storage area to see if that's where the problem originated.
As far as what we found nothing that would be consistent with the symptoms that were exhibited here at the pool today.
County officials say samples of the pool water did show an elevated level of chlorine above the state standard.
Environmental Health has closed the pool because it does not qualify regulatory standards.
Michelle DiMaggio with the county's Environmental Health Department says 10 parts per million is the upper limit for chlorine in a swimming pool like this. The water tested at 13 parts per million. That is above the standard, but could just 3 parts per million explain the symptoms experienced by 34 children that caused this hazmat response?
To this information that we have now, no.
DiMaggio says there's actually a fairly wide gap between the levels of chlorine found in that pool, the elevated levels, and the levels one would expect that would be required to sicken so many children. The county hazmat team did find compliance issues in the storage area of this facility where pool chemicals are stored, but they say that did not cause this problem, so the investigation goes on.
And Ken, what about all those kids? Are they okay?
Well, according to the fire department, all of the kids suffered minor respiratory issues. So all of the kids, their symptoms were minor, and all of them apparently are okay.
All right, Ken Pritchett in Antioch tonight. Ken, thank you.
Okay, so as you can see, this does get media coverage, and one of the things that we were very cognizant of during the media portion of this event was not to jump to conclusions and state only the facts. And I think that was very important during the day of because, as we'll show you later on during this presentation, we did an investigation as to what the cause was of this incident. But the day of, we did not understand what had actually happened at this incident. And it took us several days and mining through a lot of data to figure out what we believe did happen. And so at that time, it was an unknown mechanism to us of how this incident occurred. Briefly, I just want to talk to you guys about the command structure for an incident. Most incidents establish what's called the incident, or utilize what's called the incident command system. For this incident, we had an incident commander, a safety officer, and an operations section. And there were primarily 2 groups underneath that operations section. One was a medical group, which was manned by primarily the fire department and EMS folks who were providing medical attention to the children that were affected. And then there was the hazardous materials group, which our office responds primarily in. And I go through this to say that if you're an environmental health professional and you're responding to an incident that involves a hazardous material, you're likely going to fit into the hazardous materials group and assume a role somewhere within that group. So it's good to know that during the actual incident, during the incident that's being managed, the emergency phase, you need to know where to click into the incident command structure. Okay, I'm going to turn it over to Michelle now to give you guys a little bit more information about the pool and the mechanism that may have occurred.
Good morning. Approximately about 3 o'clock or so, Environmental Health received what's called an IRIS. In our health services, we have a program called Incident Response Information System, where we're reported on incidences throughout the county, no matter what department it is. In this particular case, we found that this was Antioch Water Park, which is under our jurisdiction and regulated and inspected at least once or twice a year. At this point, we responded. A 5-team environmental health specialist responded, and we immediately went to the incident command post as we were educated and knowledgeable about. From there on, we reported to the hazmat program specialist that was on site. From there, as you look at this structure here, there are 5 poles on site. The particular situation took place at the sports pool, and that's the, if you look at the slide, that's the upper right-hand side pole. Our inspectors went to 4 sites on the pool and conducted a chemical exam of each site and found that we had between 12.5 to 13 parts per million of chlorine, which is over our state regulation. And I'll get to that in the next slide. We also inspected, as you see here, the tadpole and splash pool and found that the pH was below 7.2. In California, the minimum is 7.2, along with the sports pool. The boulder pool and the lap pool were fine. However, due to the situation, we chose to close the whole site. So in California, our recreational health program falls under the California Code of Regulations, specifically Chapter 20, and the code that we use for this particular situation is here at 65545. And that gave us the jurisdiction to be able to assess and close the pool because of the danger of the chemical exposure that we felt at that particular time. This is a schematic of the sports pool specifically, and looking at it, you can see that the pool comes in from the water, goes through the filtration system, goes high above, and then Matt will get more into this in a little bit, to the flow meter into the chemical control unit where the muriatic acid and the chlorine are fed into. And then from there, it's the chemical controller adjusts to what is needed. And there is a printout, which you'll see in a few slides, where you can see the ORP and the measurements that are given each day. Here are some photos of the actual equipment for the sports pool. Specifically, we're, to the upper right, photo 1 is the chemical unit involved here. When we first approached, we did notice that the pH was reading normal, and that was different from our chemical on-site reading, so that brought up the first question to us. To the right is the chemical injection area, so this is where all the chemicals are being fed. To the bottom left is the muriatic acid pump, and that was immediately below, and to the picture on the right is the chlorine pump. So these were all in place. They all seem to be working properly. And as Matt will discuss in a little bit, as we went over this and spent quite a long time looking and going through the whole flow, we still could not figure what the situation was at this particular point.
Okay, so we asked the facility to provide us a lot of data, and primarily they provided it to us through their controller, which was a CAT 5000. And they provided us Excel spreadsheets that listed, as you guys can see, the date, the time, the pH reading at that point, how much pH feed time was on, how much, what this translates to is the amount of minutes that muriatic acid was pumped into the pool system, the oxidation reduction potential, which is a measurement of how much free chlorine is in the pool, the amount of time that the ORP feed time is the amount of time that the bleach is being injected into the pool system, and then the flow rate here. And this flow rate represents the amount of water that's being pumped through the system at any given point in time. And as you guys can see here, it goes from about 534 gallons per hour, gallons per minute down to 0 gallons per minute, and then it goes back up. And we'll talk about what happened during this point in time. And then there's warnings that are sent depending upon the conditions of the pool and what they have programmed into the CAT 5000. And these warnings are sent primarily by text message to the pool operator. So we took all of this data that occurred before the incident. We took a day before and through the incident, I believe through the night of the incident after. And what we did is we graphed it. And it became pretty evident to us what happened. And so I'll explain this graph here. The green line, which is at the top here and goes off and on, represents the pool pump flow rate. So when that green line is high, that means that pool water is being pumped through the system. And when the line plummets down to 0, that means the pool pump system is off. The green line represents the bleach feed time, so when bleach is being injected into the system. And then the blue line represents when muriatic acid is being fed into the system. So what we see the night before this incident occurred, and that's denoted by a red star here at the top, is that the pump is on like we would expect, and at around 10:40 or so, the pump turns off. And this is normal conditions for them. No one's in the pool at this time, and this is when they go through their backwash process. The pump comes back on and recognizes that bleach is needed, the ORP level is low, so it injects bleach for a while. And for unknown reasons, the pump for the pool water turns off. And it turns off for a period of time, and then we see that the ORP is turned back on. So the bleach system is turned back on and injecting bleach into a system that's not pumping water through it. And it does this for quite a while, 50-something minutes, and the system has a fail-safe that recognizes I've injected a lot of bleach for a period of time, but I'm getting no change in my ORP reading. And so it goes into a lockout situation where it takes a manual override for the system to continue to inject chemicals into this system. And that happens until about 8:40 in the morning. We see that the main pump for the pool system is off, the bleach is not being pumped in, and the muriatic acid is not being pumped in. At around 8:40, there is a manual system override. No one at the facility admits to pushing this button, but someone had to have hit this button. When this button is hit, as you can see, the pool water pump is not on, but this then authorizes bleach to be added into the pool system and muriatic acid. And as we'll go through here in a second, these two chemicals being injected into a pipe that isn't flowing pool water through it produce chlorine gas. So we see for unknown reasons at around 2:25 that afternoon, one of the pool operators recognizes that the pool water pump is not on and authorizes the pump to come on. And at approximately 2:29 is when we get our first 911 call to the fire dispatch system. So this data represented in a different format. You can see here the top line is when the pool water pump is on. We see that it goes off around 11 p.m. We see that bleach is introduced into the system for a period of time. It goes into a locked out situation until the manual system override comes on. More bleach is introduced to the system. Muriatic acid is introduced, and more bleach, and then the first call for 911 coincides very nicely with when the pool water pump comes back on. So going back to the schematic that Michelle showed everybody, essentially what this boils down to is the main pump that brings water in from the pool and processes it through their system was off for 16 hours, and chemicals were intermittently injected into the dry system essentially during those 16 hours and allowed to react with one another and produce chlorine gas. So as we said, acid and bleach will yield chlorine gas. And one of the unique well, not unique, but one of the properties of chlorine gas is the gas itself is not very readily absorbed by water. So what we believe happened is once this pump comes on, it pumps a bolus of the chemicals to the system as well as chlorine gas that are in the pipe. That gas percolates up through the pool water, and very little of it is absorbed in the pool water and essentially comes to rest at the top of the pool where everyone's heads are when they're bobbing around in the water. So that is what we believe to be the mechanism and the cause of this hazmat incident. Again, we didn't know this at the time. This took a lot of mining of data and a lot of conversations and inspections of the facility to determine this.
So as Matt talked about the data, when we were there, I believe it was on a Thursday, we closed the facility. We returned on the Friday because they really wanted to open up their pools. So our team returned. We did not open the sports pool because that was still under investigation. However, the other pools were fine. They fixed the chlorine and the muriatic acid, and we opened those up for that next following Saturday because they wanted to open up for business again. So as part of the records request in collaboration with the manager and the on-site maintenance manager, we had told them we would like various documents that should have been on-site, but at the day of the event was not. Some of the documents that were not present, which we had required the city basically to now maintain, were various policies. But the first thing we wanted to make sure is that all 5 pools were required to resubmit plans, basically submit specification plans to our plan review program to verify that all manufacturer specifications are being met. We also then required development of policies and procedures. Well, some of them including the cleaning of the chemical controller, again to manufacturer specifications, chemical controller and how it's being utilized, about making sure that who's doing it and who's in charge of it, logging the pump flow readings and logging the chemical control flow readings. At the same time, we had them work with our county emergency planner to create, as you see in the upper right, the emergency action plan. So this not only included incidences, but responses to any type of emergency. Also, they updated their charts, as you can see, their certifications of training, their lifeguard certification, CPR, their pool chemical logs. Basically, on the right-hand side, they also had to document what happened in their opinion on June 18th of the incident. Also, who goes in and out of the mechanical room, because they did not say who pushed that button at 8 o'clock in the morning, 8:40 in the morning. We asked them to monitor who was going inside and outside of that pump room. And the deck crew as well, making sure that they had knowledge, because they were also responsible for maintaining the chemicals. There were 2 groups that were doing the chemicals. There was the lifeguards and also the maintenance crew. So some of the lessons learned in this was we realized with the hazmat, and we'll both talk on this one, is these incidences go very underreported. We've had a few since then that, again, we learned after the fact. And also because of the awareness of our pool operators to call us during an incident. Emergency response, where do we fit in?
Yeah, and I had kind of talked about that earlier in showing the incident command structure. I think it's important for us as regulators to know where we fit in during the emergency phase of an incident. It allows us to interject our technical knowledge and allows us to gather information that we may not be able to gather later on after the incident occurs. Moving on, I think one of the things also that it allows us to do is provide technical knowledge. And in this case, it was decontamination of the victims did not occur in a timely manner, primarily because technical reference folks like environmental health regulators, hazardous materials responders were not at this incident early on. So the children that were affected that experienced respiratory symptoms also were in a pool that contained very high concentrations of bleach, amongst other things. Communications for us, we need to improve, and we've actually worked tremendously with our fire department to identify all the public pools so that they're identified in their computer-aided dispatch system. We've also worked with the 911 dispatchers to recognize a hazmat incident, and that if the primary complaints are those that are medical-like, it's important to recognize that there may be a hazmat component to this incident and to get those resources dispatched to the call as early as possible.
As part of the communications, our fire department asked us in environmental health if we had a list of the pools or recreational health facilities that had chemical controllers. And at that time, we did not, and we do plan on next year recording that information. For environmental specialists, this is where I highly stress emergency training, because if we did not have that, we would have just walked in instead of reporting to the incident command post. So what's next for environmental health? The recreational health supervisor will be doing a health officer advisory, basically putting something together if this happens, making sure that we have some kind of document available to our health officer to inform the public. We're also thinking about a letter to the manufacturers stating our concern, particularly for this particular situation, and how to basically give our inspectors more information how we can respond quicker. Lobby for change. Our recreational health supervisors will also be putting a letter together to our California Department of Public Health to lobby for change to basically include MAC and what they have on their documents, and require secondary site-specific engineering controls. So our plan review, we do require secondary controls, but there is really no law right now saying that. So Contra Costa Environmental Health is moving forward and progressing to try to make this change. Our pool lead, basically, he conducts courses starting every March, and the courses are offered to our operators, and he provides a pretty well comprehensive course basically on what inspectors look at, what forms should be available, what are the new regulations, and he answers their questions face to face. So we make it comfortable for them to come in and answer any questions they might have, because usually they may not see the inspector out in the field. We've also created more documents, like you see here in the upper right, full safety information. We update that every year, and our lead also created on the bottom left with the emergency situations for public pools. It does not only include chemical exposure, but also, for example, flooding or electrical incidences. And what basically is stated in here that the operator should never turn on a pump if it's off when there's people in the pool. That's one of the learned lessons here, is that we need to voice that if the pump is off when the operator goes there or when the maintenance person goes there, that they need to clear the pool before turning that pump on. We also updated our website, providing more information for our operators and for anybody who maintains a pool. So now I'll hand it over to Jason.
Okay, thank you. My name is Jason Wilkin. I am a CDC career epidemiology field officer that's detailed to the California Department of Public Health for emergency preparedness and response. And so Matt and Michelle just gave a very detailed presentation on the investigation of the June 18th chlorine release at the water park in Antioch last year. The presentation has a lot of valuable lessons regarding the roles of first responders and hazmat and environmental health investigators following a mass casualty chemical incident. And I hope you'll be able to take some of that training back to your agency. I'd like to conclude today by placing the Antioch investigation into a statewide context. So 17 days before the release of the Antioch pool, there was a similar incident that took place. It was a clear, warm June 1st, and a group of third graders on a field trip were swimming at a recreational swimming pool in the city of Redding, California. And according to bystanders, when the children were playing in the pool, a large bubble was suddenly emitted, releasing a cloud of yellowish gas. And children are, of course, curious about nature, and so they swam towards what turned out to be chlorine gas. One child, a 9-year-old girl, experienced nausea, vomiting, difficulty breathing, and burning chest pain. She was taken to a nearby emergency department. It was there her behavior became confused. She had rapid heartbeat and even more difficulty breathing. So she had to be intubated to protect her airway and was taken by air ambulance to a hospital with a pediatric ICU. Now overnight, her breathing improved. She was extubated the next day. Given oral steroids and albuterol, her breathing improved, and she was discharged the day after that. Now another child from that incident, a 9-year-old boy, was also taken to an emergency department with rapid heartbeat and difficulty breathing and low blood oxygen saturation. Fortunately, he did not have to be intubated. His breathing improved overnight, and he was discharged the following day. So these two children were the most severely affected by that incident, but they were not the only ones impacted. In all, 28 children were sickened by the chlorine release at the Redding swimming pool. 1 child was released at the scene. The other 27 were transported to local emergency departments for evaluation. 6 were transported by ambulance and 21 by the school bus that took the children on their field trip to the swimming pool with EMS personnel on board the bus. So there are some similarities between these two incidents. In both cases, the chemical pump continued to deliver muriatic acid and bleach when the main recirculation pump was off. When the main recirculation pump was turned back on, there was a bolus of pool chemicals that were released that caused a secondary release of chlorine gas. And in both cases, the main recirculation pump was turned back on while there were bathers in the pool, specifically children. So here's another example. In October of 2015, in the city of Danville, also in Contra Costa County, there was a power outage that caused the shutdown of a pool recirculation pump. Now, at this point, the chemical controller should have restricted the pool chemical feeders, but there was a malfunction in the chemical controller's flow sensor, so this caused a dangerous buildup in the recirculation line. And when a maintenance worker restored power to the recirculation pump, similar to what was observed in both Antioch and Reading, a bolus of chlorine gas was released into the pool. And this incident took place at a high school pool where members of a water polo team were practicing. So EMS was actually not activated as a result of this incident, so we don't know how many people were sickened, but we do know that 6 received medical attention at an emergency department or with their primary medical provider. And among these was a 14-year-old girl that developed cough, shortness of breath, sore throat, and chest tightness because of chlorine exposure. She was taken to an emergency department where she had rapid breathing and low blood oxygen saturation and anxiety. She was given albuterol and steroids and admitted to the pediatric floor. Her breathing improved with treatment, and she was discharged from the hospital on the 3rd day. Also in October, this time in the city of Santee in San Diego County, this one was a very different sort of incident, but also revealing in terms of pool chemical safety. Students and teachers at an elementary school began complaining about nausea, shortness of breath, and eye irritation around 8:30 in the morning. And persons at the school described a caustic odor. 77 students and 4 staff were transported to emergency department for evaluation. Now, this elementary school is about 1,000 feet from a nearby YMCA, and the chemical pump at the YMCA pool had failed overnight, releasing about 300 gallons of sodium hypochlorite, or bleach solution. The spilled bleach solution overflowed from a secondary containment basin into a storm drain. So a worker noticed the spill in the morning and tried to treat the spill with sodium thiosulfate, and this created a vapor which impacted these 81 persons at a nearby elementary school. Fortunately, all the students and staff were released with minor injuries. So fortunately, no one died as a result of these 4 incidents, but the chlorine exposures and impacts were quite substantial. In all, 154 persons, mostly children, were impacted by these chlorine releases at recreational swimming pools in California in 2015, and 4 were so seriously injured as to require hospitalization. So consider the presentation that we gave on the Antioch incident and also these 3 other mass exposure and potential mass casualty incidents at recreational swimming pools last year. Obviously, hazmat has a major role to play in a response to this sort of incident. Michelle and Matt thoroughly detailed the role of both county environmental health and hazmat in response to mass casualty exposure. There's no uniform standard in the organizational relationship between hazmat and environmental health. Today we saw an excellent example of how these two can work together, so I'd ask you on the phone to consider what is your relationship with your hazmat agency. Are you organized together in the same department? Do you meet regularly? Do you have joint exercises? Do you even have contact within hazmat? And the events described in this presentation might also fall under the domain of county public health. And public health organizational framework varies by county. Sometimes county environmental health and public health are in the same agency. Sometimes they're completely separate. If you have a similar incident, does your county public health get involved? Public health obviously has a stake in preventing injury and illness. Do you have a working relationship with your county public health? And the 3 agencies provide complementary methods and legal mandates and authorities for preventing and mitigating chemical exposures. They have regulatory, response, and surveillance functions. Now, in the case of California, the Emergency Preparedness Team in the Division of Environmental and Occupational Disease Control does interface with each of these functions at the state level. So to loop back to the Antioch Water Park incident, we illustrate how these different disciplines fit together. Contra Costa County Hazmat reported compliance issues related to the facility's hazardous material business plan and noticed that the facility used an unpermitted underground storage tank. And to address the recirculation system's failure, environmental health required the facility to operate as per manufacturer specifications. And to address the possible human error, the facility will have to implement new procedures and policies and training. And then the Emergency Preparedness Team at the state has compiled a comprehensive set of health effects data resulting from this and other incidents. So our ultimate goal is to produce and distribute relevant materials to all disciplines that might be involved in such an event. And this, of course, brings us to the CMAC, which I'm sure everybody on the phone is quite familiar with. And they're soliciting for updates next year. And there is one part of the CMAC that actually is relevant to this particular incident, and it revolves around interlock controls and having low or no flow. And it turns out that an analysis of this incident shows that even if the MAC code shown here was enforced, this incident still would have happened. The interlock controls and low or no flow deactivation were actually in place at this location. So one of the recommendations that we might have for next year is to strengthen this part of the code to require secondary lockouts or some other fail-safe technique to prevent the activation of chemical feeding pumps in when a main recirculation pump is off. We have not put this in writing just yet, mostly because we wanted to present this, and then I think over the next couple of months we're going to put together some draft language. Other proposals that we might have for the next MAC revision would include necessary training for pool operators regarding chemicals on site, proper chemical storage, and also, as just comes up repeatedly, but actually is not in any part of the code anywhere as far as we can see, the idea that bathers should actually just get out of the pool whenever the pump is unexpectedly shut down and then restarted. So with that, I'd just like to thank the many collaborators that made this project possible, and thank you for your attention and the invitation to present today.
All right, thank you. All right, it looks like we have about 7 minutes to open it up for Q&A, and it looks like we've already been receiving some questions in the chat box, and it looks like there's been a lot of engagement and a lot of other people joining in and answering each other's questions. I think there's a couple that we'd like to ask our presenters today. So it looks like we had a similar question from Thomas and Jim. Sorry, my chat box keeps moving. Doesn't the state require a flow switch on the chemical controller as well as an interlock with the main circulation pump? Also, what is the purpose of an override button?
Hello. So, sorry, can you repeat that question again?
Sure. Let me scroll up. Doesn't the state require a flow switch on the chemical controller as well as an interlock with the main circulation pump? And there's also another question that said, what is the purpose for an override button?
So the first question, simply yes. So there is a required for a flow switch, and the pool is supposed to be interlocked. However, in our code, it's not as specific as to have secondary responses, just if that flow is continuous, and if somebody was to be able to push that button to stop it, there is nothing to back that up. Second question, I need to practice. Second question, what was the second question?
Sure, sorry. It is, what is the purpose for an override button? With a flow switch, the chlorine would just shut off again.
Correct, but in this particular case, the purpose for the override is unknown. Basically, why would you have that in place if you know that the pump is off? That was a manufacturer specification that was included for this particular system, so at this time I don't have the response for that.
Okay. And it looks like we had a follow-up question from Philip. Is a flow switch required, or can it be a gas trap sensor to auto shut off?
A flow switch is required. The gas trap is not required.
Okay. All right. It looks like we have a question from Maggie. She said, what are your plans to summarize all of these events and learning lessons so the nation can learn from them? You have a treasure trove of info to support the interlock and flow sensor use.
Well, I think a large component of that is discussing with this targeted audience today, because we would like to propose updates next year in the revision for the CMAQ. We've also given this presentation at a couple of national meetings, and we're working on a manuscript.
Okay, great. All right, and we have a question from Karen. What is the minimum turnover rate in Cali?
For this one, it was, I think I did bring that information with me, every 6 hours.
Okay. Sorry, that was every 6 hours?
Yes.
Okay. All right, and it looks like we had some discussion from Michael Wu's question. He says, I noticed the chlorine and acid injection points are very close to each other. Is that a problem? This was discussed a little bit in the chat room, but I was hoping that you guys could discuss that a little bit.
This is Matt with Hazardous Materials. I think generally it's not an issue if the circulation pump is on, because the flow rate through the system is at such a rate that essentially the chemicals never really commingle and react with one another. They're dissolved in enough water. And I believe the system is programmed that only one of the chemicals is injected at a time, meaning that either you're injecting bleach or you're injecting muriatic acid, but you're not doing them both at the same time.
Okay, and we have a question from Sean. He says, I thought the circulation pumps are always on as well? Question.
No, I think this facility, I think in general, a lot of pools will turn off their circulation pumps at night to save money, electrical costs. But I think they also will turn them off to do backwashing of their sand filters or whatever sort of filtration system they're using for particulates.
Okay.
For part of our California Code of Regulations, it only has to be on during operation, open for use.
All right. Our next question comes in from Megan. Has Contra Costa County written an emergency action plan for future situations? If so, would you be willing to share it?
Yes. On one of our slides we have, mostly for operators, emergency situations, and I'll be happy to share that.
Okay. All right. It looks like we have time for one more question. Do either of the jurisdictions require operators to be trained and certified consistent with the MAC recommendations?
Not in California. In California, we comply with the California Code of Regulations, which at this time does not include some of the MAC. The only requirements are for lifeguards.
Okay. All right. It looks like that's all we have time for today. Just a few quick closing announcements. I had a couple inquiries, but this webinar will be posted on NACCHO's MAC Network website. I will also be sending out a follow-up email containing the link to the recorded webinar later this afternoon to everybody that was registered. Please also go to the website to check out past archived webinars that we've hosted, other MAC resources, and announcements for our future webinars. So if you would like to receive email updates and stay up to date with the MAC network, please email macnet@nateshow.org, and I'll include that email address in the follow-up email after this webinar today. But other than that, thank you so much for joining, and thank you to all of our presenters. Thank you so much for joining us and sharing all of these great experiences.
Thank you.
You're welcome.
All right. Thank you. Have a great day.
You too.